The brain. It is the most mysterious and complex organ in the human body. The way people perceive the world is determined only by how effective its nearly 30 billion neurons work together. But when something goes wrong, Parkinson's, Alzheimer's, ADHD, dystonia, these are just a few of the damaging disorders that affect millions around the world. Recovery from these conditions and even injuries that were once seemingly out of the question are now achievable. New research is showing us how amazingly adaptable the nervous system truly is. New neural pathways can be created. With simple interventions, doctors have found ways to actually rewire the nervous system.
Things that are miracles are things that you don't see very often. But if you start seeing it all the time, then what was once a miracle is just a clinical expectation.
Follow us on a journey through a new frontier of medicine. A frontier that inspired a junior Olympic athlete to become a doctor to help others who suffer from neurological conditions that she herself experienced.
There's no amount of activity that I ever did as an athlete that was as painful as that stuff.
And visit the parents of one special young girl whose physical needs are outweighed only by her gracious spirit.
I worried, will she ever live a normal life outside of our house?
These people, like many others, have had to endure the hopelessness that comes when the body breaks down and becomes its own worst enemy. This is their story. This is Hope Restored. When we're healthy, we take for granted our body's ability to do seemingly simple activities. We expect to be able to run, walk the dog, sit, and even just stand still. But for each of these to occur, our brain must be able to tell our bodies how and when to do them.
There is nothing in your system as a physiologic being that is not informed by brain function. Your brain is where you have your entire sensory and cognitive and perceptual experience of the world.
The nervous system has the basic function of receiving and transmitting information. That's what it does. It receives input from our environment around us, and it transmits information, and it gets interpreted, and then it's an output system.
The human nervous system, comprised of the brain, spinal cord, and retina, is a fantastically complex network of pathways, responsible for processing the immense amounts of information we expose it to. But when an accident or disease causes a communication failure in our nervous system, our ability to perform is limited. The question then becomes, can it be repaired? As long as some form of communication is still occurring, the answer is yes.
If you can imagine the nervous system as a very complicated highway, and if you've got a blockage on one route, you've got to take a detour to get there. And in some patients, unfortunately, all the bridges are out. So we need to have some viability of the nervous system to make a change.
The brain can change. We can actually rewire the nervous system, and it's a very vitalistic and truly preventative way of interacting with patients.
A multitude of obstacles can impede the brain's ability to function. Conditions such as head trauma or lack of oxygen at birth are just a few examples that can prohibit the brain and nervous system from communicating correctly. Meet Mackenzie. Born with cerebral palsy, her parents found themselves thrust into the unfamiliar world of special needs children.
So when we got the bad news about Mackenzie, about her brain injury and the severity of it, boy, our world just went upside down. It just went upside down. See how tiny Mackenzie is, there she is. That's after just about 2 months in neonatal intensive care. So she was in there. So in truth, we don't know if the brain injury occurred then. We don't really know when. We were afraid to touch her, you know, really, you're afraid to pick her up. So we go see a neurologist, and of course we said, okay, well, is she gonna get better? What's her prognosis? It wasn't good. It was not a good prognosis at all.
All we heard about was what was wrong with her brain, how much damage had been done to it. I worried about her being institutionalized. I was worried, what if something happened to me? I worried, will she ever live a normal life outside of our house?
So, how do you heal, or in this case, rewire a nervous system that is compromised from birth? Conventional medicine told Mackenzie's parents that physical and occupational therapies were the only options they had for their daughter.
It was so neurologically frustrating for her. She'd spend a whole hour crying versus us seeing any real value in the therapy.
Well, and we would just put the question right to the therapist. We would say, plain and simple, is rolling a ball at my daughter with cerebral palsy, is that going to, help her to walk someday? And these little 1 hour sessions, 2 times a week, we just did not see that was the right path for us, that was not going to achieve the results we wanted for our daughter. So we began looking for other alternatives.
The alternative they found was functional neurology. This specialized field uses a variety of non-drug and non-surgical approaches to bring improved functioning to the brain and nervous system.
The types of patients or subjects that we see as functional neurologists are often those that have been around the gamut and have lost hope.
Dr. Frederick Carrick is considered by many to be the father of functional neurology and a pioneer in the field of neurology as a whole. Discovering the potential of the brain's countless abilities to heal itself has become his life's work. Along with a small army of doctors, Dr. Carrick has spent more than 30 years perfecting various techniques to treat many neurodegenerative issues.
Typically, what we do in healthcare is people have a problem and we identify the problem or the pathology or the disease, and then typically we treat that. So if you've got something wrong here, we can cut it out or take it out or do something. Our approach is a little bit different. We address, first of all, that pathology and take care of that, and then what we do is we look at the other concomitants of humanism and we increase that function.
The functional neurologist has a unique ability to assess the functional state of one's nervous system, where their areas of strengths and weaknesses are, where their areas of dominancies are, and really utilize different types of methodology, different types of treatment to enhance one's health.
I see, okay. No, I get it.
People ask me frequently, what's the difference between functional neurology and medical neurology? Neurology is neurology. It's just about functionality of the brain and the nervous system. The only difference isn't the science, it's rather the application. Our approach is about trying to find ways to take other pathways through different kinds of sensory inputs that will stimulate different cells that need stimulus.
We can look at an individual, examine their nervous system, find out not only what they can see, what they can hear, what they can smell. If they've got some possibility to do it better, then we can tap in on that, and then we can increase those functions and give vibrancy to people that they haven't had before.
This approach caught the eye of one doctor. Dr. Krista Hubbard became interested in functional neurology while exploring ways to treat her own condition, a degenerative disease known as dystonia.
When you have dystonia, not only is it you have the vices within your muscles making them really tight, but you also have, when you go to move a muscle, another muscle moves. So it's almost like you have vices on your muscles with them all being connected with weird little strings and rubber bands. So you go to move one and it's a big old rampant puppet show that happens, and it's just, and you're not controlling it anymore.
Krista developed dystonia while as a student, and it soon progressed to the point where her future seemed bound by a wheelchair and her life expectancy was lessened.
There's no amount of activity that I ever did as an athlete that was as painful as that stuff. Not even close. Not even close. As my system started to degrade, there was no position that eased it. Even a stretch of your muscle to try to relax the muscle makes other muscles contract. Freaky, freaky, freaky stuff. It's terrible, terrible, terrible. If someone had said, hey, Krista, Ryan, it's gonna get to the point within a 1.5 years' time that you're gonna have trouble walking, we would have almost laughed at that. We had no idea the magnitude of the fallout that was gonna happen. Here, oh, this one's not bad. This is Junior Olympics. So, first you lose your athleticism, then you lose your ability to study, then you lose your ability to be a wife, then you lose your ability to be a mother, then you just lose your ability to even function as a person that's engaged in the world. I was in the fight of my life to figure out the mechanisms of dystonia and figure out a way, an intervention to try to stop it.
Krista spent years researching potential treatments for dystonia as her condition continued to worsen. Utilizing every resource she had available to her, she was still left without answers. Until one day, she received an unexpected response from Dr. Carrick.
Bless Dr. Carrick's heart, he wrote me an email. And it was my first form of communication with him himself. And it was sent on my anniversary, September 4th, 2009. And he said, Krista, I reviewed everything, and it looks like you're gonna be a lucky girl. And I just bawled. I just bawled my eyes out. And Ryan came downstairs and he just held me. And he was just like, oh my gosh, Krista, maybe there's hope, you know? Maybe we're gonna be okay.
Throughout our lives, our brains are constantly changing. Input from our senses allows the nervous system to learn and adapt to its environment. This is known as neuroplasticity. So when something interrupts the natural functioning of the brain, doctors can take advantage of this unique adaptability process to try to either correct or bypass whatever is disrupting the nervous system.
We know there is pathology and we have to identify pathology, but then to find out what's still viable, what part of the nervous system is still connected and is still working, that we can use as our avenue, as our application window to get in there and stimulate the brain and make changes that are long-lasting. It is very empowering to a patient when they can understand that their nervous system does have the ability to regenerate, their nervous system does have the ability to rewire, or the neuroplasticity of the nervous system. And that is exciting because they can see changes. Where they used to get imbalanced, now they feel more stable because their nervous system is able to handle that environmental aspect of just standing up in gravity.
When we do individual movements or parameters or exercises, we cause physical changes in the brain. We call them plastic changes because the brain can change. And as a consequence of that change, we change function.
This knowledge that the brain can change was exactly how Dr. Carrick was able to provide a renewed sense of hope to Kevin and Rhonda about the direction of Mackenzie's treatment and her life.
Well, you can do them all.
Dr. Carrick looked at the brain scans and said, okay, folks, so here you can all see, here's where the problems are, but look at the rest of this beautiful, magnificent brain. Look at what we have to work with. And he just got right to work with, on her brain and a plan of how he was going to try to make, positive changes for Mackenzie.
Giving us hope that
very
the brain
exciting.
Is still, there's a lot of plasticity in it, and you could continue to rewire it and get the brain well. And that is what we're seeing.
This wasn't always the case. Prior to seeing Dr. Carrick, Mackenzie's therapy throughout the years became a grueling affair that involved the entire family. But the gains they saw seemed to continually be outweighed by the process.
Her entire body is involved in this activity, in this therapy. Everything is moving and being worked, and it's helping the brain to understand what's going on here. And this is how else could you teach a child to creep and crawl on their hands and knees? How else could it be done? So we had to force our brain injured child to experience all of the developmental steps and milestones that every well child actually experiences. I wish that we knew Dr. Carrick back then. So
it would save me a lot of hours of hard
boy.
work.
When we,
and Kenzie.
Yeah, when we told Dr. Carrick that we did patterning with Mackenzie for 10 years, he said, wow, I know about that stuff, and that's just so much work. Folks, you're gonna love my program because you're gonna get your life back. Not only will Mackenzie continue to get well, but you're gonna get your life back. So really piqued our interest.
We know that the nervous system is forever changing. The brain is very adaptable. It's adaptable from the time of conception to the time we take our last breath. There's constantly changes taking place for better and for worse throughout our nervous system.
If you have only 2 neurons left, only 2 neurons in your entire nervous system, there are things that you can do to make those 2 neurons talk to each other better. and make them capable of carrying on that conversation for a longer period of time before they get tired.
This was the moment when Krista's life changed. Dr. Carrick's examination determined that her recovery was certain. But the most surprising thing for Krista to discover was just how fast her recovery would be.
I went from not knowing if I was ever going to be able to work again, walk again, raise my kid, not knowing if I was going to be in a wheelchair, but a high probability that I would be. And then within 2 months' time, I felt like I was a little out of a slingshot, just ready to go and learn and seize it and definitively know I was going to hopefully make a difference.
If we're going to be able to help somebody, we're going to know very, very quickly. Within a day or so, we're going to see improvement. And it's not something that we're going to have somebody go under treatment or say, well, we're going to do this for 6 months or a year and see how you do, or even 3 weeks or 4 weeks. We're going to see some changes very, very drastically.
Within the first 24 hours, the vices were less, the overwhelming sensation was less, it was dramatically less painful. I wasn't someone's puppet. There was more control that I had personally instead of the nightmare.
Knowing now that the brain can be rewired, how does a functional neurologist know what can be changed, and how do they go about activating those changes?
Pain or symptoms are just one little bit of the expression of the nervous system. There's actually many, many other things that we look at as parameters that really let us know the functioning and balance or homeostasis of someone's nervous system.
Things that we deal with on a daily basis is simply looking at one's balance and coordination. We also look at people's blind spots. We're able to measure how they may have areas that they can't perceive as well in the environment because of a change in the stimulation in one's brain.
Clap,
Tap, foot,
clap, tap, foot.
When you look at someone that's got a compromised brain, generally we find that the smaller interventions have a much bigger effect than bigger interventions because they've got compromised cells. They've got cells that are very, very fragile. And the game in functional neurology isn't so much just try to figure out which cells to stimulate. The hardest part is trying to figure out how far to push them. We do a lot of eye exercise therapy and things along those lines. In many cases, that can have a very, very profound impact on the brain because it fires some very precisely selected cells that are exquisitely targeted.
Many people can have good functioning individual parts of the brain, but they may not be working in sync. If they're not functioning in sync, you may simply have to do something that appears trivial to the layperson, from an eye exercise to a spin, to a particular type of hand movement, to a particular type of cognitive exercise, and that may make a world of difference for that individual.
Our examinations are very specific to the whole person, their reaction to their environment and the consequence of the environment on them. And we do things and teach them, empower them to be able to cause changes in their own nervous system so that they can adapt better to their situation, so that they can live better lives. And we're very, very successful at it.
Because these therapies are specific to the individual and are generally very minimal, patients are able to see results and gain freedoms, giving them the renewed balance needed in their day-to-day lives.
It used to constantly be a day of stress for actually the entire family. I was frustrated because I felt like none of us ever had any downtime. However, our therapy day session, since we've started functional neurology, is about a fourth compared to what we used to have to do. We do a lot of eye exercises as well as vestibular exercises with her.
Okay, everything good? Anything gonna fly off? Got any diamonds and stuff that you need to protect? What's really neat about this is that there's really no other way that she could get this dosage of stimulation. Her brain wants her to stand so far forward, and so Dr. Carrick is trying to reposition her brain's perceived center of verticality.
Incorporated into Mackenzie's daily routines are more therapies. Even activities such as going to school are considered another opportunity for her. Because of her functional neurology treatments, walking and interacting with other students are just a couple of areas that have seen marked improvements.
She is just like a well kid in this situation, and this is all also, of course, part of her therapy. You know, it's all part of getting well.
We are seeing incredible gains with our daughter.
Yeah, her balance is better than ever. Her speech is better than ever. Her walking now is better than ever. My gosh, every single day we're seeing improvements. Just they're very minor.
As a matter of fact, yesterday I think she was up to 20 seconds standing totally independently. That was huge for us.
That's a first. That's a new world record for Mackenzie, you know. So that's great. That's really good stuff.
Your exercises, right? So it's like this. Palms up, palms down, quick as you can go. You're going to do both sides like this. Palms up, palms down, quick as you can go.
When looking at Krista today, nothing about her indicates the struggles of her past. Her therapies have allowed her to follow her dream of helping others with neurological disorders. She now operates a thriving functional neurology clinic in northern Michigan.
I set up my weeks and my calendar and my planning and my days so that I can get my exercises in on average about once an hour. They take, 4, 5, 6 minutes or so, and if I can do those, get a good night's sleep, I'm doing really super. I can work out during the day, and I can work and I can be a mom. My worst day now is a small fraction of the discomfort that I had at its worst.
Patients are going
Can you cheese, George?
It's gonna go like this.
Now I know how hot the fire can be. I know how bad it can get. And I know that things can progress so quickly for people that I urgently and desperately am rowing my own boat just as quickly as I can to learn this information from functional neurology. I know that I can make a real impact in one person's life.
The brain is at the very center of who we are and how we operate. Unfortunately, neurological dysfunctions have many faces, and each requires a specific type of treatment. The functional neurologist has developed unique skills that allow them to attend various patients that suffer under these dysfunctions.
The type of patients that we see are largely patients with a variety of different movement disorders, learning disabilities, kids that have behavioral problems and learning problems, and pain syndromes, of course.
We could deal with a variety of different conditions, from elderly people that have neurological degenerative conditions to the middle-aged individual looking to maximize their health, or an athlete that really needs to be functioning at an optimum level.
We're helping these people who probably have been to many other providers, who probably have been told they may never be able to achieve milestones along the way, and to just have them get even a small improvement to them, it's very profound.
The one thing that we do know is that the earlier we get patients, the greater the probability that we can increase their function and maintain their function over a greater period of their life.
We also realize that more and more, a lot of the disorders like cardiovascular disease and diabetes and digestive problems and autoimmune diseases are being contributed to, can be completely caused by a breakdown in functional neurology of the brain, because the brain is what regulates it all. Diabetes, heart disease, cancer, many of these disorders are the end result. So if we're dealing with those with medicine, we're dealing with the end result. As we understand functional neurology, we'll be able to impact these things at the onset or before they end up resulting in a breakdown in the body.
So there's a lot that a patient can do every day at home that's going to drive their nervous system specifically. And then we can see them in the office to update and change that, because their nervous system is dynamic. It will change, and they need to be monitored and find out what we need to change with their exercises or their nutrition or anything else. It's always a wonderful thing when a patient comes in and says they aren't having any symptoms per se, they aren't in pain, but they need a tune-up. And with a patient like that, we still go through an assessment. We still look at their nervous system as we would anyone, and we find if there's any imbalances or any areas that need to be addressed, and then you can give them exercises at home. You can do specific treatments in the clinic to correct that imbalance so that it never manifests as anything more serious in that person. And it truly is preventative healthcare in that form.
I think it's very important for all people, regardless of their age, to have a competent neurological examination, get a baseline of activity, and if things are not working perfectly, then do something to make them move, to make them work, maybe not perfectly, but much better than they were, and prevent disease and degeneration.
Because neurodegenerative conditions are becoming more and more commonplace, it's good to know then that new solutions are being found every day. Mackenzie's journey can be seen as a testament to that hope and to what functional neurology holds in promise.
Functional neurology is definitely something I would tell you to look into, because we're living proof of having a very profound child to today being classified as possibly mild cerebral palsy. So our goal is 100% independence.
Independence, that's it.
Without any crutches.
My family has been a big part of my life, and also was even a bigger part though in my family. And sometimes I wake up in the room and I don't really want to get out of bed yet, so I just lay there and think to myself, how did I get so darn lucky to have 3 angels living in my house? I do. I have 3 angels living in my house. And I think to myself, what did I do to deserve this? You got all my inspiration. You are keeping me forward. And I could not ever thank you enough.
When people send patients to us, they generally come back in a much greater level of functionality than they were when they arrived, and the results aren't being generated by other professions. What I generally see with patients is they go back and they talk to their medical neurologist or their primary care or whoever, and the response winds up being, you're doing better than any of my other Parkinson's patients, what's going on? Or you're doing better than any of my other stroke patients, what's going on? And it's only for one reason, it's because the results are there.
Physicians from around the world of all different disciplines are starting to realize that perhaps they can make a difference in a different way of human function. And I think that that's very, very refreshing.
Today, degenerative neurological conditions are so commonplace that 80% of the population will develop some type of brain disorder by their 65th birthday. People around the world are now discovering functional neurology as the future with a promise of restored hope.
You know, right now we're still stuck in most of our treatments that are directed towards looking at lesions or looking at the bad part or looking at the metabolic disease. What we see is that functional neurology is the future. I think that within the next 10 years, we're going to see that this is functional neurology is now the mainstream of all different types of therapies.
Really, the sky is our own limit of service to others. So it's a rewarding situation, but frustrating in trying to do things that maybe we'll never be able to do, but that we're not going to give up without trying to do it and to understand it, and also to share with people throughout the world so that they might be able to do it too. And the game doesn't stop with 1 doctor or 10 doctors or 100 or 1,000.